confirmed a healthcare worker who might have had contact with Thomas Eric Duncan's clinical specimens is on board a Caribbean cruise ship right now.
Now, we know that worker has not shown any symptoms and as a precaution has quarantined herself on that ship. We're also learning that the State Department is working to remove that person from the vessel.
5 days after that first healthcare worker got sick, Dallas County leaders are now trying to restrict the movement of other healthcare workers as far as travel, as well as going into public places. Now, according to a government statement, the healthcare worker that left Galveston on the 12th, the same day as we learned Nina Pham tested positive for the disease, and just 3 days before we learned nurse Amber Vincent tested positive for Ebola, is now somewhere off the coast of Belize. Now, so far, this latest worker has not shown any signs of the disease, but the government, as you mentioned, is working to get the woman and her husband back to the States as soon as possible. Now, earlier this week, there were some Dallas County leaders who raised the idea of restricting travel of 87 healthcare workers, but they didn't.
We're dealing with heroes, not criminals. None of these people have done anything wrong other than be in contact with the bodily fluids of an Ebola victim.
And now, after yesterday, they are asking these workers to sign a voluntary agreement that does 3 things. It restricts their travel, it requires them to self-monitor, and it's also asking them to avoid large public places. Now, keep in mind, all of these rules are being implemented while there are still lots of questions about why the CDC cleared nurse Amber Vincent to get on a plane and fly from Cleveland back here to Dallas.